My name is Kristine Alvarez, for those of you who don't know me. And as Janet mentioned, I'm a director of advisory services based here in our Philadelphia office. So it's just a real honor to be here with everyone here today, and just really excited about the turnout. And just want to reiterate again just how much we appreciate all of you taking time out of your busy schedules to be here, especially after what might have been a fairly busy primary night last night here in PA. And so just before we get started, just want to take a quick moment to just provide some background about NFF. I know that I see many friends among us, but just very quickly, Nonprofit Finance Fund, we basically do three things. We provide loans to incredible mission-driven organizations. We provide consulting services to organizations and their funders to help connect resources to their mission outcomes. And third, we promote big ideas like this that we think will advance and accelerate the field's ability to tackle big and complicated social challenges and to just help accelerate the pace that we get to build a just and vibrant society here in the United States. And to be honest, in that work, and I sit on the advisory team, we only get to make a difference at Nonprofit Finance Fund when our clients and our partners that do the hard work in communities get to succeed. And so I see a lot of leaders in this room who are doing the incredible work in our communities. And so just to be clear, like, the focus today is about hearing from them, about how, what this movement means and how it's working for them. But before we get there, I just want to take just a few moments and hold some space just for some reflection about the video, about what it's going to take to create a system that we can all orient around outcomes so that we can achieve better results for our community. And so just as a jumping off point, I'm literally just going to shout out a couple of tremendous organizations. There are many, but just a couple that we've had the great privilege of working with who are already doing this work and focused on achieving outcomes. And so I'll start with an organization that really transformed themselves around outcomes. And many of you know the Nurse Family Partnership. This is a national nurse-led maternal health and home visitation program for low-income, first-time mothers. And they work to improve pregnancy outcomes, healthier mothers who can deliver healthier babies and set themselves and their children up for better success. Their nurses begin visiting expecting mothers as early in pregnancy as is possible, and they help them through a variety of issues that affect prenatal health that include smoking cessations, healthy diets, information on how to access proper healthcare professionals and doctors. And it's really this trusted expert guidance that has been proven to lead to healthier outcomes. NFF, we could really go on and on, about the Nurse Family Partnership's measured outcomes that are just so outstanding. But just to name a couple, or just a few, their outcomes include decreases in prenatal cigarette smoking, fewer hypertensive disorders of pregnancy, fewer subsequent pregnancies that are closely spaced. And so would definitely recommend that you take a look at the chapter that they wrote in the book about what outcomes and orienting around outcomes in the transition has meant for them. The next is the Bowery Residence Committee, and you may have noticed in the credits that their CEO, Muzzy Rosenblatt, helped and consulted with us to develop the video. BRC today is one of the largest homeless services and comprehensive social services agencies in New York City. They provide a wide range of programs that start with outreach for those who are unsheltered. BRC helps clients with housing, with shelter, workforce development, and ultimately helps them onto independent living. And so fundamentally, BRC is about creating opportunity for people to transform their lives. And BRC is an incredible example of an organization that figured out how to organize around outcomes. They really envisioned their work as not simply filling beds and getting paid, but really setting up their clients up for a better life trajectory. BRC is focused on outcomes. They continue to measure and use the data to inform and improve their practices. And one really great example is that when they started to see their recidivism rates go up as compared to the previous year, They looked into the issue. They looked at their data. They found that it had a lot to do with the elimination of rent subsidies. And so former clients were no longer able to afford housing in the crazy housing market that is New York City. So they just couldn't afford to stay in their homes. They returned to homelessness. And so for BRC, their focus on outcomes meant that they could just no longer continue to operate in their own silo, that for them wasn't solving the problem for their clients, and they decided to help own the solution, and they became low-income housing developers. So when you hear stories about BRC and the Nurse Family Partnership, you may be thinking to yourself, well, we're all mission-driven organizations, so what's really the point? I mean, of course, the point is that we're in this work, to solve really challenging social issues and to end homelessness and to make sure that young mothers and babies can ensure that they're set up and that their families are set up for a better life. But the reality is, but the reality is that that is just not how we currently organize our social system. As we heard about in the video, in most cases, the funding that flows to organizations, it's really oriented around outputs and typically pays only for outputs. And David mentioned, sort of like the movement, particularly in PA, about preparing young children for kindergarten. In many cases, when you operate a high-quality childcare organization, the payment, you get paid to take care of children. It's for the care. And so you're not paid necessarily, or at least not on a full basis, to set these children up for success and to be healthy adults, later in life. And if you run a health center, you're likely paid for the number of patient visits that you're able to achieve, not necessarily prepared to ensure that those patients get healthy and that they stay healthy. Muzzy Rosenblatt from BRC has said to us that if you run a homeless shelter, it's more likely the case that you are really paid to stay and be in the hotel business. You're not paid to be in the business of ending homelessness. You're paid and perhaps even incentivized to keep those beds filled. And what if those beds are filled by the same people for a year or for 2 years? An outputs-based funding model, it often doesn't give homeless shelters the space and the resources that they need to pay for the kinds of services that get people out of those beds in a permanent way. And so in all of our work with nonprofit clients and with funders, we know that the aspirations of our clients, they are really to achieve the things that are on the right-hand side, of this slide. And while we want to acknowledge there are some incredible organizations, both in this room and across the country, who are starting to do things differently. But most funding rewards organizations for achieving only outputs. And the current system is really set up to just solve problems for the short term, not for the long term. And not to go off, too much in a tangent, but I'm a little distracted, by here in Philadelphia, there's been a lot of news about Chris Long and his retirement from the Philadelphia Eagles. And so just on a personal basis, when I've heard that news, I've been sort of sad and also just nostalgic, for Super Bowl 52, which, by the way, was not really that long ago, just to be, very clear. But can you imagine, what would have happened if we applied an outputs-based funding system to our most beloved Philadelphia sports team, the Philadelphia Eagles? In the 2018 season leading up to Super Bowl 52, we might have had one funder say to us, I will pay you if you can make sure that Alshon Jeffrey catches 4 passes for 50 yards in every game. And you might have had another funder say, we will pay you if you can make sure that Fletcher Cox can sack the quarterback in each game, especially if that quarterback is Tom Brady. And perhaps another funder might have said that, we will pay you for each time that Carson Wentz actually stays healthy to actually play a game, which I know, just saying it, I know that it feels and is just way too early, to be joking about that. But basically, Doug Peterson, he would be spending basically all of his time filling out paperwork and making sure that we had all the documentation that the funders needed to just prove that his team did all of the things that that they were paid to do. And he certainly would not have had time to work with his talented players, to innovate and to figure out legendary plays that actually lead to better outcomes. And I have to, just reference, plays like the Phillies special, which, that not only came at a really important point in the game, but is admittedly, one of the best plays that will go down in NFL history. Our Eagles up against the favored New England Patriots. And so I just think that, it's important to reflect on, they were able to kind of as a team figure out what would get us, to a better result. And so now in that case, the outcome is very clear. Winning the Super Bowl is a clear outcome. And for the NFL, we have created a system that makes a lot of sense and organizes resources in order to achieve that outcome and to give their players and their coaches the freedom to innovate and to take calculated risks to figure out how to make that outcome happen. And so maybe that's funny. And certainly if you funded the Philadelphia Eagles in an outputs-driven way, they would not have gone on to become Super Bowl champions. And maybe it's funny, for us to even think about that. But really, there's nothing funny about taking something that is so clearly flawed and forcing the people doing the most important work in our communities in some of the most resource-constrained settings and giving them a set of constraints that they wouldn't even impose on a football team. And so a lot of this work is about saying something that is so clearly a better way of working in one setting, we hope, would be a better way of working and addressing the most important problems that we face as a society. And now, of course, the problem with that Eagles metaphor, aside from the fact that we gave away Nick Foles to the Jaguars since, is that social change, it's much more complex. Poverty is a lot more complicated than figuring out how to win football games. And so let's just be real about what this is going to take. And for us to orient around this new way of working. And then we will be hearing for the rest of this morning, from people who are working on these various parts of the system. Now, we are not naive or Pollyannish about the transition to outcomes. This is hard stuff. It's systemic. It's going to require a lot of us to work and dig into the challenge. So it's certainly not without its challenges, but we know that the direction and the opportunity is right. What this book and this campaign is all about is, has been really focused on what this shift will mean for a change in behavior for the 5 essential parts of the system. And so the first is service providers. We know from our work in every city that we operate that there are some service providers, despite not being funded to do this, are stepping up, to operate in an outcomes-oriented way. And to be effective, we're expecting these service providers to move from tracking outputs to managing results, from focusing on compliance and all the infrastructure that we've been building around compliance over time to now be able to develop the muscle to innovate and to innovate effectively. And then from doing one small part of the problem to fully taking more ownership of the problem as we saw with BRC. Second, government, we're asking them to change as well. For a whole set of reasons, it's a lot easier to pay for activities than it is to pay for results. And we don't want to minimize this difficulty at all. It's hard from a political perspective, not just a technical one. And it's easier, to ensure compliance than it is to assess performance. And frankly, it's safer and less risky to say that we're going to take money and tell organizations what to do to fund what is known and what we've always known and done, rather than saying that we took taxpayer money and gave it to these organizations and let them have the space and the latitude to innovate and follow their own path. And so the fundamental role of government, we're asking, must move from a control role to a more of a collaboration role, saying what we do want to achieve in society and then resourcing organizations to achieve those things. And again, this is difficult, but we have to tackle the challenges around the politics as much as the technical aspects of making it happen. We're also asking private donors to move away from program grants, which certainly is a lot easier to budget for and to get our arms around as compared to asking, what is the full cost of delivering outcomes on a sustained and ongoing basis? And from a technical perspective, as a foundation, we can get really good at project budgeting. It's a lot harder to understand the financial health of these organizations we're supporting when and if we give them flexible funding as opposed to restricted funds. And so we're asking this system too to change as well, including their boards and their leadership into a whole new way of working. And finally, there's a new role for investors. When we at Nonprofit Finance Fund as a CDFI and all of the other investors lend to organizations, we're admittedly lending, at least up until this point, to organizations that are paid on an outputs basis. When we made, that $2 million loan to BRC, we knew that as long as they kept having beds filled, they'd get paid by the state, we'd get paid back as investors, and that's financing in an outputs-based way. In an outcomes world, BRC would only get repaid if we actually got people out of homelessness. And so it's a new muscle for us to figure out how to lend to organizations being paid on outcomes where the payment is riskier, but ultimately the return is worthwhile. So as investors, we too have to figure out how to assess what is most likely to take our money, which organizations are most likely to take our money and be effective at generating those outcomes, and to adapt our own lending programs accordingly. And so in many ways, we're asking them to go from being a provider of capital to being a real partner in helping these organizations work. Now, for our clients and communities, there's a very real element for all of us to consider and to name. We're ultimately doing this to create a more just and vibrant society. And the focus on outcomes and the measurement required with outcomes, it is going to require us to act and participate with our clients in a different way as it relates to data collection. We'll be asking, or what it will require us to is following up with people after they've perhaps left our programs and our services, and asking personal questions. And so we have to be thoughtful and careful and sensitive about how we do this. But the trade-off for clients is that we actually have a shot, at providing services for the long term and not just treating a patchwork of problems. The opportunity is that we can provide services that are integrated, they're easier to access, and are more meaningful. And so the last thing I'll just say is that this transition to outcomes, it is exciting. While we've all heard a lot about pay for success, there are a lot of other ways, that this is being explored. And the book certainly gets into a lot of detail, and examples, from outcomes rate cards to prize competitions to the first ever environmental impact bond in DC with DC Water. And so just one quick example, beyond pay for success is advanced market commitments, which has been applied in global public health. It's discussed in the book, and it basically says to anyone who's out there that there's something that we really value in society, and we're going to pay for it. Just as an example, we value reducing gun violence, and we really need guns that recognize fingerprints so that only someone with a certified fingerprint can actually fire that. And if the gun gets into someone else's hands, it doesn't fire. But the market economics right now, they don't make a lot of sense, and there's not a whole lot of financial enticement, for private companies to spend a lot of money developing that capability. But advanced market commitments, they say we will commit that the government will pay a certain volume of these at a certain price for police departments and buy them from whoever can make that product work. So we're basically saying that for whoever can achieve the outcome, we'll find you a reliable way, to get paid. And so that's just one example. There are others. So that's a preview of the opportunity. We're excited to get to the heart of the program today and hear from our speakers about what it's going to take and what this looks like from all different seats in the social sector. And so just want to say thank you all for being with us today.